From the crack of dawn, staff packs the food pallets, ready to be loaded onto the trucks.
We are now currently over 1,000 organizations, and that has caused that where we were doing 250,000 meals a day in distribution, we're now doing over 450,000 meals a day.
These trucks act as mobile food banks, delivering supplies to the needy homes.
And especially with COVID last year, it has had a big impact on South African society across the regions, where you have more people at home and you have more people unemployed, more people not able to feed themselves anymore.
Organizations such as these aim to send food to rural communities in need, providing fresh and canned food.
Our mobile rural depot program ensures that we target vulnerable rural communities all across South Africa, making sure that they get food on a monthly basis to make sure that they get the proper nutrition.
Working closely with farming communities, preventing excess harvest from landing up in landfills is key.
By engaging with farmers, we are able to ask them to donate their surpluses, those goods that are out of spec for who they're growing for, where they've harvested more than was required.
The food truck makes the long journey to the delivery sites. Scores of beneficiary homes keenly awaiting the arrival.
It means so much because we provide 3 meals a day. It's breakfast, lunch and supper. And you know, we have almost 50 residents that we feed.
The food is then sorted and stored to be prepared for the more than 100 patients there.
Funds is always welcome. We've got a macro account, okay, so where our logistics manager can go and buy food for our residents when we don't get enough donations. We've got a Dis-Chem account, especially with winter coming up, where we're going to need the medicine.
Many of the people here have a physical disability and need constant care. Access to 3 square meals a day goes a long way.
It's quite a big operation to provide health and also food security, blankets, clothing, all of those things to all our residents. So it's impossible for us to do that by ourselves. We do get subsidy from the Department of Health, but that only makes up 55% of our total income. So we need people out there to help us.
With more than 11 million South Africans facing acute food insecurity due to poverty and inequality, closing the food gap is critical. Nozintombi Mia, SABC News.